Happy New Year. Today's January 1st, 2018, 9 months, 2 days after my double jaw advancement surgery to correct sleep apnea, and just under 4 months from the nasal reconstructive surgery with rib graft to repair a collapsed septum and nasal deformity that was a result of the extubation from that first procedure. So in a 9-month update, I'll give you a quick one just on my health overall. First, I'll start with the appearance. For the last couple of weeks, I've seen some people, around the holidays that I haven't seen for a while who have said to me that, since they've seen me last, I looked a lot more normal, like pre-surgery, than they've seen since they saw me last, which is great. I've also had more than a few people ask me if I've lost weight or if I'm fit again, and the answer to that is no, but I did notice by going back and looking through some pictures and even looking in the mirror that it appears that the inflammation on my lower jaw has gone. And so I had heard and expected that it would be 6 months, 9 months, maybe a year for the inflammation to be going. And what really made me notice it is in the morning, because of the nose surgery. In the morning, I wake up and my my sinuses along here, my nose and my upper lip are still inflamed every morning when I wake up. I almost look like Beaker from the Muppets, which is not ideal, but it absolutely shows that the jaw line the swelling has gone away. So my jaw looks much more defined for the first time since the surgery. So I'm pleased about that. As far as the feeling and the nerve sensation, I'm still very tingly all along here and kind of not numb, but tingly. I feel it for sure. I actually feel it more than being numb. Like I'm coming out of Novocaine. My bottom lip is very numb and tingly. My upper lip is very stiff because during the nasal reconstructive surgery, they did a second incision all along the top. They removed 2 plates and 10 screws to create some relief for my sinuses because the jaw and skull have healed. So my lip is still stiff. My nose from the cartilage from the rib is very hard from the frame that they built on the inside of my nose with rib cartilage and wire, whatever they used. It's still very hard, so that means that my upper lip is not yet pliable. And the only feeling I have from a nerve sensation is really it feels like I have a chapped lip. So the nerves appear to have come back, and that's good. I still expect the swelling to be there for a little bit of time. My nose surgeon said when I saw him 2 weeks ago at about a 3-month update, he said that I'm about a third of the way there, I guess, from the inflammation. It's going to be a while, and I'll probably have to have another revision surgery on my nose just to clean some stuff up, straighten stuff out, make it look a little bit more symmetrical, maybe trim some of the cartilage, like up here is not connected to anything, so he might want to get rid of that and do some other minor things, but we won't know until we get much closer. But I would say that from an inflammation perspective, when someone says 9 months, I think they mean really 9 months, because it was like a sudden thing that people noticed the change in my appearance and looking like I lost weight when really it was just the swelling was gone. In terms of the other nerve sensation inside of my mouth, still cold sensitive, bottom teeth, lower teeth, upper teeth. When I drink cold fluids, I can feel it. The roof of my mouth, my palate area, is very tender even to the touch. If a piece of food that's hard, like a hard candy or like a pizza crust or food that's kind of tough, hits the roof of my mouth, it sends a tingly sort of sensation. It's kind of painful all along my upper gum line, and it's very painful to floss, both upper and lower. Teeth are super sensitive in between when I try to floss, and my gum lines are really, really sensitive when I floss. It is a pain. It's required. It's needed, and it's something that's not comfortable. So when I eat or I floss and I brush my teeth, that is what bothers me the most. So I think it's going to be a while for the nerves. They said up to 12 months. I've seen some people on here who have given their updates who they've said exactly 12 months, and then they knew where the nerves would be. A couple of people have told me who have experience with nerve regeneration or recovery or whatever that I probably am where I'm going to be, but I'm hopeful and optimistic that it will get a little bit better, but we'll see, and I guess time will tell. So the only thing that's bothersome overall is that I've been stuffed up for 9 months since the initial surgery. My wife did say that I'm snoring, and she recorded it, and it sounds pretty loud. Not apnea, I don't think. I have to do another home sleep study. I did not do one scheduled because I knew I was having nose surgery. It makes no sense to do a study and then have my nose rebuilt. So now that I'm almost 4 months from post-nose surgery. It's still, again, inflamed on the inside, but I will have an opportunity to do a sleep study to see if the apnea is gone or maybe it returned in a different way, because now that my airway is open in my throat, my nose is closed, and I think that's what's causing the snoring. I am waking up with headaches again. I think the snoring is worse, or the inflammation is worse in the winter because of, normal sinuses, and that sucks, but we'll see what happens. Again, the inflammation in the nose is about a third of the way gone, both inside and outside. It's getting more flexible and pliable along the nostril area, which is good. That means the swelling is going away. This part is still hard as a rock, and it will be until it matures, and the swelling goes down. So, I was told that if it's hard, it's still swollen. So I'm waiting for that to go away, and hopefully that'll make a difference. It's for sure going to make an appearance difference in the upper lip and the nose area. Because it's so stiff, I can't really show my top teeth, which bothers me. It does cause me to lisp a little bit at times, which bothers me. So once that's more pliable, my nose is more flexible, pliable, my upper lip works better, the muscles are reconditioned, and I can actually see my upper teeth when I speak and when I smile. Hopefully that'll help with the appearance overall, and hopefully help with the feelings overall, because I'm just uncomfortable all the time. I've learned to live with it, of course, because it's been 9 months, but I'm still uncomfortable all the time. So the jury is still out on whether or not this was going to be deemed a success from a overall health perspective and sleep apnea perspective, because one problem being resolved probably caused another. In that, with the chronically inflamed sinuses and nose, I'm now taking Sudafed more than I should, sort of the nose spray more than I should, which is now causing a spike in blood pressure, which sleep apnea causes a blood pressure spike. It went down significantly, and now that we've gotten to the winter and I'm more stuffed up than normal, blood pressure is going back up as a result of the medications. The second I go off it, the blood pressure goes down, so I'm trying to wean myself from that and just kind of live with it. So that's where I am right now. 9 months and 2 days. I'll probably do another update as I get closer to a year, unless there's a significant change at 10 months and 11 months. I'm going to re-record the pictorial review because it's like 16 minutes long, and I think I'm going to try to make it to 5 if I can do that, and maybe that'll be more helpful for people. So if you are curious about the results after 9 months, I would say inflammation for sure, 9 months. Nerves, not quite yet. I'm hanging in there, and hopefully if you're going through it or about to, you've got the kind of patients that can wait that long for the result. So hope everyone's doing well. Hope everyone has a great 2018. I'm sure as heck glad that 2017 is behind us, given the challenges that I had with the surgery and the recovery and the complications and the lifestyle change that is very significant that happens as a result of the surgery. I'm looking forward to 2018 as being a better year, a year of recovery, a year of health, and a year of renewal. So hopefully you all have a great new year, and I will speak to you all soon. Thanks.